Case study by Dr. Nestle Shah. How to diagnose. Mayo Clinic is number one clinic in the world, and this is due to good history, and examination is the key to great practice. These are the words which were told when asked, why is Mayo Clinic ranked the first clinic in the world? First case, a toddler, 3.5 years old, came to the ER with his mother complaining of a sleepless night with severe earache and running nose. Ahmed, a toddler, 3.5 years old, male, lives with his family in Banha. Chief complaint, running nose and stuffy nose. Yesterday, severe pain of the left ear, rubbing and pulling it, increased temperature. Severe pain, sudden hearing loss, fever was moderate, above 37 degrees and a half. History, patient had recurrent common colds. There were no special habits in the family or relevant history. On examination, the general condition of the toddler was normal for his age, flushing, moving the head side to side, and crying. Local examination, bulging of the drum and congestion was found. This differential diagnosis, this is used to confirm the diagnosis in otitis media, acute otitis media. It is sudden, short duration with no discharge. On examination, there is a bulge drum with congestion. Tuning fork test will be Rene negative and lateralized Weber. In recurrent otitis media, it is generalized, intermittent, and there can be discharge. The drum is either bulged or perforated with less congestion. Also, the tuning fork will be the same in otitis media with effusion. It is gradual and long in duration, and there is no discharge. On local examination, we can find dull drum with bubbles and hairline due to fluid level, and also the tuning fork test will be the same. These are pictures of each of the before mentioned diseases. In this case, we will give antibiotic for 48 hours. If the patient does not resolve the infection, we will do laryngotomy to prevent perforation of the drum. Second case, a baby with difficulty in breathing and increased during sleeping on the back and failure of feeding. A female infant complaining of stridor increases while lying down. The The baby lives with a family in Banha with no special habits. There is stridor and no hoarseness. There is stridor and no hoarseness. The baby improves on lying prone. Family history irrelevant. On examination, generally normal build, feeding problem, normal crying. Locally, omega shaped epiglottis, which is redundant during direct laryngoscopy or fiber-optic laryngoscopy. Differential diagnosis between laryngomalacia and laryngeal web. Laryngomalacia, both the children are days old. Type of stridor in laryngomalacia is inspiratory. In web, it is both inspiratory and expiratory. No hoarseness in laryngomalacia, positive hoarseness in web. The site is in the epiglottis in laryngomalacia and glottis in the web. Duration until 2 years. Patient usually improves in laryngomalacia and in laryngeal web, usually we need surgical interference. Thank you and good luck.